So patient education is key to the success of the dental appointment and the comfortability experience while the patient is at our dental appointment. As we know, we hear all too often about how uncomfortable or nervous the patient is for any dental procedure. So patient education, when it comes to taking an alginate impression, is crucial to make sure we get a very good, accurate impression so the patient understands and what to expect. Sometimes that nervousness is that we're just not sure what is happening from it comes to the standpoint of the patient. So the first thing that we're going to do is make sure that we're on the same page, that the patient understands why they're here today. Hello, Mr. Smith, you're here to get a lower impression, to have a partial made, and I'm going to go ahead and try my tray in first. A lot of times our patients will say how how much too big this alginate impression tray feels, and just an explanation that the tray is going to feel slightly too big because we need space around the existing teeth to make sure our tray does not scrape along the teeth when we're getting that alginate impression. So when I go ahead and try the tray in, I'm going to explain that to the patient, and then I'm going to explain what should that alginate feel like. How is that consistency? How long does it need to be in the mouth? So Mr. Smith, I'm going to go ahead and take an alginate impression. When I put the alginate material into the tray and put it in your mouth, it's going to feel slightly as a cold temperature. It's going to feel a little soft, sort of like a thick bubble gum. It needs to stay in your mouth for about 45 to 60 seconds. I'm going to hold the tray in place where it needs to be. As a patient, I do not need you to close together. I do not need you to move anything in the tongue, in a sense, out of the way. I, as the assistant, will guide you on what I need to do during that impression process. I'm going to go ahead and take the lower impression first, and then I'll follow with an upper impression next. When I'm taking that upper impression, if you feel a little bit gaggy or have a little bit of that gag reflex, I'm going to go ahead and breathe with you about taking big deep breaths through your nose, and help maybe point your chin to your chest to help make that comfortability of that impression even better. So now our patient is expecting the temperature. They're getting, they know how long that impression is going to be in the mouth, and they know that I'm going to help them guide them during that impression period if they get a little bit too uncomfortable. So once that impression is in place, I'm going to be naturally face to face and make sure I have that patient in the position where I can accurately see to make sure I'm going to get the anatomy that I'm looking for as well. So if the patient is getting a lower impression and I'm going to take that upper impression next, sometimes they'll question, why am I taking that upper impression even though there's no work being done there? And understanding and explaining to that patient that even though we're not doing any work or making any prosthesis device on that upper, that the lab needs as much information as possible, and the more information that I can give that lab accurately, the better off the prosthesis that is going to fit like a partial or the denture on the mandibular. So patient education is important when taking impressions, the dental procedure, why we're taking x-rays. So if you don't have an explanation of how you would talk to your patient, get prepared. It is something that takes some time on, in the sense of we hit that play button and we get something pretty accurate of an explanation to our patient over and over again, but make sure your patient is prepared so that appointment is a success. So thank you for watching. Hopefully this helps with that patient explanation. If you need help, let us know.